Mammography is dear to my heart because that although any medical profession, you're dealing with people, you're
Right.
serving people, but mammography is different because it's personal.
I figured you'd say,
Personal. And you are, I feel like I'm literally saving lives. Every patient that I encounter, of course, they're probably 90% of the patients that I interact with, clean bill of health. But every now and again, that would say 10%, unfortunately you have ladies who are diagnosed with a breast cancer.
Wow.
And then, it's time for us to love on them.
Right.
Time to embrace change and be about that life. Good afternoon, good evening, wherever you are. This is Dr. Bass, the Lifestyle MD, and again, I am here to talk to you in October about breast cancer awareness. As you know, breast cancer is the #1 cancer in women and the second leading cause of cancer death. Unfortunately, African Americans are disproportionately affected due to multiple reasons, and I wanted to get to the heart of why that is. Now, in some cases, it is just not having access to care, but even when access is available, what we see is that oftentimes we just aren't aware of, let's say, what services they are. So today, I'll talk to you about one of the key things. Well, I won't talk to you. I have an expert with me, Miss Delicia Wilson, who is what we call a mammography expert, a technician. This is something that I'm not familiar with, but I brought her in to talk about what mammography is, how it's beneficial to you, but we're going to learn a little bit about her first. So, Ms. Wilson, can you tell me a little bit about yourself and what made you get into mammography?
So my career path was actually gifted to me. It was selected for me, but opportunity presented itself, and I was able to venture off into the mammography modality, and here I am. 10 years
Wow.
later.
Now you said it was gifted to you. Now, how did you move into this? But what's the process? Because I'm sure there are people out there that are wondering, how do I, get into radiology or mammography or those type of things? Because it sounds super complex. I'll tell you that much.
It is not. It's literally a program, much like any other program that you would pursue. It's a 2-year program if you were to pursue it on in the civilian sector. Military, a little bit shorter, a little bit different, but still the same training, still the same information. Once you go through the 2-year program, you test for certification. Once you're certified, you're a professional, you're a technologist.
Wow. So 2 years, you learn. Now, how many? Now you can go pretty much any, field in radiology. What made you pick mammography? What made you choose that one?
Mammography is dear to my heart because that although any medical profession, you're dealing with people, you're
Right.
serving people, but mammography is different because it's so, what's the word I'm looking for? It's personal.
I figured you'd say,
It's very personal. And I feel like I'm literally saving lives. Every patient that I encounter, of course, they're probably 90% of the patients that I interact with or that I examine, clean bill of health. I
Right.
see them the next year, and then I'm good to go. But every now and again, that would say 10%, unfortunately you have ladies who are diagnosed with a breast cancer.
Wow.
And then, it's time for us to love on them.
Right. Wow. That is beautiful. And to know that you chose something. And most times when I think of radiologists, I think of a dark room, you're just reading, but that's the other side of it. That's the other side of it, right? Because I know as a cardiologist, sometimes I can just start reading echoes. I had never seen the patient, but I'm reading echoes. But the fact that you feel that personal connection, and you mentioned 10%. Well, again, that is true. We know that, breast cancer is, impacts, 12.5% of women. So 1 in 8 women are affected, right? And when you think about that number, unfortunately, African-American women, again, who are near to my heart, I'm a son, I'm a husband, I'm a father, and we have a tendency to present later, present with higher stage disease. So again, knowing that African Americans and communities of color oftentimes present later, is there a role for mammography to allow for early detection in breast cancer?
early detection is key. It's key. I say the sooner we detect the cancer, the earlier, obviously, that we're able to halt it, stop it from metastasizing, growing. So the earlier, the better. Obviously, in order to do so, you have to be, I tell ladies that you have to be familiar with your breasts.
Mm-hmm.
You have to be familiar with your bodies, and most women we know our bodies. So just being willing to do those self-breast exams, and having those conversations, those formal risk assessment conversations with our providers, and knowing our family history, absolutely. The earlier you know, the better the prognosis, the better the outcome for most patients.
Wow. I mean, that's powerful. So part of it is knowing yourself. The second part is having a relationship with your primary provider. And then finally, doing something that I know that I don't do really well, and that is knowing your history, right? Talking to grandma, grandpa, talking to the folks, because, certain breast cancers have a large genetic component, meaning, and I know that individuals who have a family history of breast cancer are also at higher risk. Now, many of the tests in cardiology I've had a echo, I've had a stress test, I've had EKGs, I can't relate. I don't know what to tell my patients what to expect with the mammogram. I know many of them say it's uncomfortable and painful, and I can pat them on the back. I can't relate. What goes on, as much as you can tell us, with the mammogram? What happens?
Honestly, it's not as bad as most women have heard.
Okay.
And I think that is one of those factors that prevent a lot of women from coming in to see us. It's because they've been told by mother and mama and aunt and cousin, girl, it hurts.
Right. That's what
It's uncomfortable, but it shouldn't be painful. Mammograms should not be painful.
Okay.
I think if you, I would say the majority of mammographers, we do understand the complexity of what we do. And so we tend to be a little bit more gentle with our patients. So I think just being willing to, that mammographer being willing to explain the procedure, it's a very quick, easy procedure. Or should I say exam.
Okay.
4 views. We literally take, I don't like to use the term pictures, but for lack of better words, we literally take 4 pictures of the breast.
Wow.
And it takes longer for the lady to disrobe or change into the gown than the actual exam itself.
How fast is the exam, if you don't mind me?
Very quick. We literally bring our patients in. I would say if it's a first time visit, a baseline appointment, it takes a little bit longer because you want to explain, you want to, make your patient comfortable and explain what you're doing, because of course it's a very sensitive area.
Right.
So we explain what we're doing, why we're doing it. But literally we're taking the breast, placing it on a plate, compressing the breast, which is not the fun part, but it's not the worst. We do it for both breasts. We take a top to bottom view and a left to right view, and that's it. That's it.
Wow. So you said,
don't listen to what you've heard.
You said don't listen to mom. Okay, now, if you say don't listen to mama and grandma, okay, now she said, I didn't say don't listen to mama and grandma. She said that, I don't.
But I will say this, the new technology today is so much better.
Okay.
It's so much better. So I do believe that maybe in, times before, that equipment, maybe even seasoned technologists, they probably were a little bit, I guess would say rough.
Okay.
And the equipment may have called for more compression, but now not the case. You have 3D mammograms where literally you compress the breast just enough, and that tower will scan the breast, give you a nice 3D image. It's so much better. It's so much better, and it's so helpful. The earlier, the better.
Wow. That's amazing. Just to hear, because again, like I say, I hear it as the cardiologist and them complaining. I think I had one patient come in, had a mammogram and said she had chest pain. I said, well, what? It wasn't a heart chest pain, but I said, ma'am, I don't know but I knew she needed it. And it harkens me back to an old adage where they talk about an ounce of prevention is worth a pound of cure. And I think in terms of breast cancer, early detection and management, that's important. Now, I know that although breast cancer predominantly occurs in women, there are small subsets of men who have had breast cancer. Now, have you ever had a man get a mammogram or?
Yes. It doesn't happen very often, but, yes, I have.
Wow.
Honestly, a lot of times it's due to supplements for our younger. I tend to see with the younger patients, they come in because they have enlarged breast tissue,
Right.
gynecomastia, which is sometimes just simply from taking too many supplements to go to the gym.
Wow.
But I have had older gentlemen, and even I would say as young as maybe 40-ish, I honestly forget the age, that was diagnosed with breast cancer.
My goodness. Yeah, and it's a small proportion, but when I was reading the information to try to prepare for this, I saw that segment and I said, man, that's unsettling. But to know that, I guess, men, we need to know our breast tissue or our pecs too, Just don't touch them for the gym. Look at them and make sure that you don't have anything and know your history. That's the other thing, knowing that if you had mothers and sisters and a father or a brother or so, to make that same move. Well, I can tell you, I've learned a ton, and hopefully, and I'm not going to say hopefully, I'm going to say I know that this is going to help me explain to my patients, and hopefully as my patients or different individuals that I talk to see this, they'll understand that, again, an ounce of prevention is worth a pound of cure, but it starts with early detection and knowing your breast. Now, if you had any final things to tell folks as we kind of transition out of here about mammography or breast health or whatever you want, let them know.
So what I will say is a question that I get quite often is, when do I start to have mammograms? And typically it's 40.
Okay.
There are some other factors that come into play, again, such as family history. So if mom was diagnosed at 40, then daughter would be screened at 30. So 10 years before the age. If grandmother was diagnosed at 45, daughter would be screened at 35. Another thing is with African Americans, we tend to, we're more susceptible to breast cancer. And for the women who are diagnosed, we, for whatever reason, unknown, it is the more aggressive form of breast cancer, which is inflammatory breast cancer. So I would say, again, know your breast, be aware of your resources, but definitely for African American women, just understand that it's not an old woman's disease. It's not an old woman's cancer.
Right.
Literally, you can be diagnosed at 20, 30 years old. Also, I've had the question, when should I stop having mammograms?
Right. That's another.
And I tell my patients, as long as you have the breasts and as long as you're concerned with breast cancer, you continue to go. I've examined a patient as old as 90, and I've had a patient who was 70 that said that I don't even want to know if I do. I'm at the end of my life, as her words, not mine. And I'm not concerned, and she decided to not come anymore.
Wow.
So 40 is the start, but again, know your breast, do the self-breast exams, have conversations with your provider. If you're unable to afford, just being able to cover the cost. Right. There are so many resources available that those mammograms are free, completely free of charge. You just have to look into the resources in your community.
Wow. Well, thank you so much. Again, I feel like I'm empowered, I'm educated, and I'm energized to talk to my patients about breast cancer awareness and mammography. Now, when we think about how to live, or if we're going to be about that life, again, remember that life is living intentionally forever. Thank you. We truly hope you enjoyed today's episode. If you did, share it with a friend, leave a comment, and certainly join us for our next episode of the About That Life podcast.